Hi everyone, I'm Dr. Naz Al-Jafari. I'm a functional medicine doctor, and for Breast Cancer Awareness Month, in association with Basil Market, I'll be talking to you about a functional medicine approach to a cancer treatment protocol. Just to set the scene, cancer occurs because of a dysregulation of your immune system. And therefore, when we're choosing an approach, we want to try and modulate the immune system. And given that 90 to 95% of cancers are caused by lifestyle due to their impact on the immune system, then the cornerstone of any plan is going to be addressing lifestyle. So let's start with nutrition. Really the idea here is to move away, practically speaking, from a inflammatory westernized diet and shifting more towards a more balanced dietary pattern, such as the Mediterranean diet, which you will have heard a lot about. Now, what are the specific recommendations? Well, you want to try and aim for at least 10 servings of different types of vegetables a day. Similarly, as a general guideline, I suggest aiming for 50 unique plant-based foods in a week, because the key to immunity is not just ensuring the intake of plant-based foods, but actually getting a diverse blend of plant compounds, such as the polyphenols and flavonoids, which have that immune regulating activity. What's interesting, some of the foods that are highest in these immune modulating compounds are spices, herbs, cacao, tea extracts, and actually, most importantly for breast cancer, soya beans and cruciferous vegetables have a marked impact on preventing and also improving the outcomes with breast cancer as an adjunct therapy. At the same time, we recommend consuming or increasing dietary fiber, roughly 30 grams per day, in order to cultivate the gut microbiome, and reducing immune offenders such as added sugars, salt, high glycemic foods such as carbohydrates, and excessive saturated fats. Another consideration is pesticides, which we know have an impact on immune function. So where feasible, eating organic is also preferred. What about stress reduction and management? Well, we know that acute and chronic stress dysregulates the immune system. We now have the ability to monitor stress through biofeedback markers such as heart rate variability or HRV, which are these great little devices now which can tell you whether your body's stressed. They also form a way of us monitoring the impact of our strategies and help sort of track resilience building approaches. And, there's a huge amount of research now behind mind-body practices. The collective literature also suggests that there's a far more favorable response when it's repeated and it's consistent in nature, so it's properly integrated into one's lifestyle. What about sleep? Well, sleep, as we know, due to its restorative and regulatory effects, getting good quality, sufficient quantity, and adequate deep sleep is key in maintaining immune function, as well as, in particular, during times of disease. It's advised that people practice good sleep hygiene and maintain consistent sleep hours by doing things like turning off screens, ensuring the room's cool, quiet, and dark, and setting reminders sometimes just to go to bed on time. There is a substantial amount of evidence to suggest that sleep disturbance, such as insomnia or lack of quality sleep, even just one night's of reduced sleep, is associated with disturbance of the immune system. Leading on now to social factors and connection, I actually also encourage patients to reduce exposure to interactions which they perceive as hostile and non-supportive, and at the same time emphasizing and encouraging spending time with people who are positive or affirming. And, for those people who may be lonely and isolated, as well as those who are at risk of immune compromise, I recommend regular social connection as a routine. And this could be anything from virtually through to participating in religious or spiritual groups, or even, hobbies which may be group-based. It's well documented to have a positive impact on people's outcomes. And then there's exercise. Well, we know that moderate, regular physical activity helps immune system function by raising the levels of infection-fighting white blood cells and antibodies. And, it really has to be personalized because, there is no one size fits all. And if you're sedentary, it may be a good idea not to overdo it, because the research suggests that if you're unaccustomed to strenuous or prolonged exercise, you might reduce the function of your immune system. So it needs to be tailored really to the individual in terms of duration and intensity, and that's something you can work with your doctor on, and something that the heart rate variability is very good at giving feedback on. So I hope I've given you a whistle-stop tour. That's all for now. I hope you enjoyed it, and do let us know if you have any questions.